Thank you for joining me for this third session on the examination of the hand. In this session, I would like to describe a systematic examination of the hand. Hopefully, you will have watched my first two presentations on the hand, in which I have discussed the anatomy, the physiology of the various tests that we will be carrying out. In the next talk, I will describe a more specific examination of the hand, where we are looking at conditions such as de Quervain's tenosynovitis, carpal tunnel syndrome, and various deformities, etc. I'm now going to go over a routine examination of the hand twice, the first time with a bit of commentary and some explanation, and the second time without the commentary. I will carry out the examination across the narrow table, and all I need for the examination is a manila folder and a K-wire bent at one end. I will have taken a history of the patient, noting particularly any history of trauma. So let's begin. This is Chris, and thank you, Chris, for agreeing to be the patient for today. First thing we do is inspection. Have a look at the hands, front and back. We're looking for swelling, we're looking for scars, deformities, muscle wasting, particularly of the thenar and hypothenar eminences, etc. We then relax the hands on the table and we look at the normal cascade of increasing flexion from the index finger down to the little finger. We then inspect the dorsum of the forearms, looking for nodules and any skin lesions. We then examine for the motion. Open fingers, close, turn it over, open, close, back this way, open and close. Then we do examination of the wrists, flexion, extension, and ulnar deviation, radial deviation. And then we check for pronation and supination, pronation, supination. And at this stage, what I like to do is get the patient to squeeze my two fingers, in this hand squeeze tight, and then pinch my finger between there, and pinch the finger on that side. Terrific. Now we come to the examination of extrinsic function, the extrinsic muscles, and we'll remember that the profundus attaches to the base of the distal phalanx of each finger, and that moves the DIP joint, whereas the superficialis attaches to the middle phalanx and causes flexion at the PIP joint. Now we have to be able to distinguish between the two, and the way to do that is to put the MP joint and the IP joint in extension, PIP joint, and then the flexion that occurs at the DIP joint is all due to profundus. And the way to isolate the superficialis tendon is to hold all the fingers in extension and then flex, and you can see all the flexions occurring at the PIP joint, and you can see that the distal phalanx is floppy. So we test for the profundus, bend there, profundus, bend there, that one, and for the flexor, the thumb. And we test for the superficialis, bend up that one, and that one, and that one, and that one. We then test for extension of the wrist, hold it up, extension of the fingers, making sure the MPs are in full extension, and then extension of the thumb or retroposition of the thumb. We're now going to test for intrinsic function, and we describe three tests for the median nerve and the ulnar nerve. So testing median nerve, we've got abduction against resistance, we've got opposition against resistance, and we also look for wasting of the thenar eminence. Testing for the ulnar nerve, open the fingers wide as you can, hold them out, testing for abduction, and always test for abduction of the index finger for the first dorsal interosseous. We then test for adduction, hold tight, next one, hold tight, relax, hold tight, relax, and then we then test for adduction of the thumbs. And remember, if your adductor is not working, you get a positive Fromen's test. And remember, we've said 3 tests for the radial nerve, 3 tests for the median nerve, 3 tests for the ulnar nerve. Next, we test for sensation, and we test for the sensation of the tips of each of the fingers, remembering to test for both sides of the ring finger, And we also assess sensation on the dorsum of the hand. And remember that the autonomous zones are median nerve, ulnar nerve, radial nerve. So that's median nerve, ulnar nerve, and radial nerve. Finally, we test for the arterial supply of the hand. Remember, we've got the radial and ulnar arteries. So it's Allen's test, and what we do, we block off the arteries, open and close the hand, open, close, leave it open. See how it pales. When you release, you can see how it flushes. Then test for the radial artery, open, close, leave it open, pale, relax, see how it flushes. I'll just repeat that now without the commentary. So let's have a look at the hand, inspection. Just like that. Okay, now hold the hands like so, close, open, turn around this way, open, close, open. Okay, let's test for the wrist, this way, that way, and together, and that way. And then give me the hands this way, there, and give a good squeeze, tight, and this one, good squeeze, tight, and pinch between my fingers, and pinch on that side. Excellent. Take this hand, now bend that one down, that one down, that one down, that one down, and the thumb. Now bend that one up, that one, that one, that one. The radial nerve, lift up the wrist, hold it up, fingers up, hold them up, lift the thumb up to the roof, hold it there, that's great. Now on this hand, lift the thumb up to here, that's great. Put the two together, hold tight, relax, check for wasting. Open the fingers wide, keep them apart. Lift this one up against my finger, test for the first dorsal interosseous, and we test for the adductor power, hold tight, relax, tight, relax, tight, relax. Hold the paper like that, try and take it away, that's great. Sensation, there, on the dorsum, and then that one, that side, and that side. Now, what I want you to do, open and close the fingers, open, leave it open. Okay, open and close, open, leave it open. Terrific. A hand surgeon colleague in England who saw my first two videos on the hand has made a suggestion which is a pearl. You will recall I suggested 3 tests for each of the 3 nerves supplying the hand, 3 for the median nerve, 3 for the ulnar nerve, and 3 for the radial nerve. You may have noticed that for each nerve there is a test relating to the thumb. Abduction for the median nerve, adduction for the ulnar nerve, and extension for the radial nerve. So in fact, you can test for the motor power of all 3 nerves using only the thumb. Median nerve, ulnar nerve, radial nerve. Beautiful. Thank you, Jeremy. Finally then, using the autonomous sensory innervation and movements of the thumb, let me suggest a screening test for the sensory and motor function of all 3 nerves supplying the hand, which can be carried out in under 15 seconds. Median nerve, ulnar nerve, radial nerve. We've got median nerve, ulnar nerve, and radial nerve. Excellent. Once again, thank you for your attention, and I hope that you will join me for the final talk in this series, in which I will describe specific conditions affecting the hand.